So in terms of, we talked about testing, contact tracing, and isolation. We've been focusing on contact tracing. What are some of the challenges to actually implementing these things as a step toward getting back to lifting some of the stay-at-home orders?
Sure. And then just one last thought, too. Our last discussion is around, the ongoing interesting balance for public health is individual sort of liberties versus protection of the public health. And so this pandemic is certainly testing that at all levels, how much individuals are willing to give up their own liberties or not for the good of the public health and our authority to do so and our enforcement of others, which is one of the challenges as far as case and contact investigation and isolation and quarantine.
So what do we mean by what should we be doing about isolation?
Yes, that's a great question and certainly is an issue. So, as you just said, effective isolation would be if someone is really kind of on their own and not living with other people that they're having contact with. But then, of course, you need to make sure that person can get food and get care and those things. And so, and there are certainly a lot of great protocols, or even if people live in a small enough, or in a household where they can have their own bedroom and their own bathroom and someone could sort of bring them food but not have close contact with them, then secondary cases in that household have been somewhat able to be prevented if caught early enough. But I think as far as what we need, again, to more effectively contain this pandemic is to make sure that, as you just asked, that if there's someone in a crowded household where they can't have their own bedroom and bathroom, that we really should be trying to house and isolate them safely. And on that note, I think there's also been work in other countries and starting to happen here as well. If there are healthcare workers who are at high risk of exposure, allowing them to live outside of their homes so that they, if they are because they're at high risk of becoming infected, that they're not then infecting their household members or their loved ones. So that is something that we are doing, and again, jurisdictions across the state and the country are really working on getting places to put people that can't isolate safely. And we also issue, early on, as far as trying to contain, we issued legal isolation orders that have a lot of details on all the things that they need to be doing to make sure they're staying away from others, and again, has a health officer authority that could be enforced by law enforcement. And then because the numbers start to become big, we then issued what we called blanket isolation and quarantine orders to just make sure people realized they were under that authority, that they needed to stay isolated. And so that's just another layer as well. But certainly housing and making sure people can be safe. Another big effort of us and others is obviously people can't shelter at home if they don't have a home. So really trying to find places for our homeless population, which has been a very unfortunate crisis before this pandemic, and trying to, move people, especially those who are most vulnerable as far as the elderly and those with underlying medical conditions have been the higher priority here, trying to get them into hotels and places where they can have individual rooms and being able to, again, safely isolate or quarantine those people as well.
So finally, what will county health departments need to successfully contain COVID-19?
Yeah, I think all of the things we talked about, which is, having our testing capacity be up to what we need so that we can really be testing everyone we think has symptoms, everyone who's been a close contact, when we have outbreaks or even individual cases in high-risk settings, to be able to test those people and then isolate those cases and do that contact tracing and quarantine their contacts, and also just to make sure that we're as a community doing as much physical distancing as possible to really minimize transmission and slow the disease spread is what we need to do. So we appreciate the community coming together to help us reach those goals.
Right. So it is a community effort.
Absolutely.